Thank you for joining this presentation. My name is Starmans. I'm a PhD student at the Erasmus Medical Center in the Netherlands. And today we're looking at gastrointestinal stromal tumors, and more exactly at the differential diagnosis and the mutation stratification based on CT using radiomics. So I have no conflicts of interest to disclose. So here we're looking at gastrointestinal stromal tumors, or GISTs, which are rare mesenchymal tumors, and these are often quite difficult to diagnose. This diagnosis consists of two parts, basically. So first of all, we need to determine whether it is actually a GIST and not another GI tract tumor, which might appear similar on imaging. And second, you might want to determine the c-KIT mutation and mitotic index, because these are prognostic factors for these patients and might help you determine the correct treatment. However, this diagnosis is quite difficult to do in imaging, so therefore currently an invasive biopsy is used. So therefore the goal of the study is to find a non-invasive alternative based on CT using radiomics. So let's first take a look at the dataset that we're using. The dataset consists of 227 patients, of which there are 122 non-GISTs, and there they are a mixture of different tumor types, and 125 GISTs. So while these patients were all referred to a hospital, the scans originate from different centers, which causes some variation in the acquisition protocols, as you can see in the image on the left. For all these patients, the ground truth was determined by using pathology. Next, let's take a look at the radiomics method. We start off with the CT images, on which a clinician manually segmented all the tumors. Next, we're going to extract features from all these images, which give us information about the tumor. These might be simple descriptors, such as intensity, for example, the mean intensity, or the shape, so whether a tumor, for example, looks more like a circle or a star, but also more complex texture features, for example, the heterogeneity of a tumor. We do this for all the patients, and we end up with features for each patient, and we know the label of each patient. So for example, in a differential diagnosis, whether a tumor is a GIST or non-GIST. Next, we're going to use machine learning and some pre-processing methods to find a decision model. However, there's a whole variety of methods out there, and we don't know beforehand which one works best. So we've collected a lot of different methods in our toolbox, and then we're going to use automatic algorithm optimization to determine the best combination of methods and parameters, which will give us the best performing decision model. Let's take a look at some of the results, first for a differential diagnosis. So for all experiments, we use a 100 times random split cross-validation to make sure we separate the parts the model trains on and tests on. And on the top left, you can see the ROC curves for our models. So you can see that using solely CT imaging works quite well, but adding the location of the tumor improves the performance. So we've also asked two radiologists to score these patients who had access to CT, age and gender, and you can see that they perform similar to our model. We also tried adding age and gender to the model, but it did not result in an increase in performance. Next, let's take a look at the c-KIT mutation analysis results. There were 123 GISTs with a known c-KIT mutation, and a majority of these patients had an exon 11 mutation. Therefore, we created a separate model for c-KIT and c-KIT exon 11. For other c-KIT mutations, there were two small numbers to make a separate decision model. On the left, you can again see the performance of our models, and you can see that both for c-KIT and c-KIT exon 11, but also for the mitotic index, the performance is similar to guessing. So what can we conclude from the results? So we saw that our radiomics model can actually distinguish GISTs from non-GIST tumors, and the performance was very similar to that of two experienced radiologists. However, radiomics cannot yet distinguish the c-KIT mutation or the mitotic index of GISTs. So what could we use such a model for? Well, potential use is of course a diagnostic workup. So we can now distinguish these patients using this model. But also, for example, in clinical trials, you can use our model to select patients instead of doing a biopsy. Of course, the study also has several limitations. So while we did use a multicenter CT dataset, we did not truly externally validate our findings, which would be very valid to do. Second, our model currently relies on manual segmentations, which is not feasible in clinical practice. This may be solved by using an automatic method, for example using deep learning. Third, there was this variation in our imaging protocols, which might have affected our performance. And last but not least, we could not determine the c-KIT mutation, but it might be due to the limited size of our dataset for the c-KIT mutation. So here is my ethics and funding information. And last but not least, this radiomics method that we used is actually open source, so you can use it if you want. So it automatically determines the best workflow per application, so it's very easy to use and therefore also very generic. So if you look at ECR this year and also previous year, you can see that we've actually used it in quite a variety of clinical applications with success. So if you want to try it out, just follow this link or contact me. Thank you very much for joining this presentation.